Everyone knows Chinese people are disgusting. They'll eat any type of animal. They're dirty. That's what my classmate said just days after the coronavirus outbreak started in the United States.
Ask the Chinese for a formal apology.
Virus arising from a meat market in eastern China.
As the coronavirus spreads, there's another virus spreading that we need to be talking about.
I hate Asians.
A woman who's Asian says she was punched by another woman in Midtown Manhattan, and she accused her of having the COVID-19 virus.
This Chinese restaurant was texting their customers saying, none of our staff have been to China. We have no contact with the coronavirus. Please, come back to us. And people were making fun of it.
There are thousands and thousands of cases in Italy, but no one's boycotting Olive Garden.
Yeah.
Seriously, no one's boycotting a mom and pop's pizza place.
Historically, pandemics have stoked xenophobia. In the 19th century, people spread rumors that Irish immigrants carried cholera, and tuberculosis was known as the Jewish disease. In 1900, when a Chinese man supposedly died of the plague in San Francisco, Chinatown residents were forcibly quarantined by police, while white residents were allowed to leave the area. Coronavirus may have originated in China, but the disease doesn't discriminate in the way that people do. It's extremely important that people have accurate information on how to stay safe, so we can kill this virus without spreading another one.
From my experience with treating patients here, I'm finding that we have more than half of the COVID cases are within the African American population, and that speaks again to the health disparities that we have here.
We're seeing high rates of death and illness among African American, Hispanic, Latinx populations, and so we're failing to protect our vulnerable.
In the state of Connecticut, for instance, I think it was quoted that 8% of individuals who are white they test positive. Over 30% of individuals who are black are testing positive.
A lot of African Americans have to, work more than one job, and getting paid sick leave is an issue. So a lot of people will still go to work even when they don't feel well.
Whether it's doctors or medical people or frontline healthcare workers, you typically trust the types of people who actually look like you. As a result of that, we need to work a lot in creating that trust.
Inside Idlib's largest COVID-19 hospital, doctors are stretched to their limits. As soon as one bed frees up, a new patient enters.
We need the international community to increase its support. We've reached a point where the medical system has collapsed, and the resources we have are not enough to control the widespread impact of the virus.
After 10 years of war, Syria is ill-prepared to handle COVID. Half of all hospitals are out of service or partially functioning. The UN says in the last 2 years, Russia and the regime have targeted more than 80 medical facilities. 20 miles north in Idlib's countryside, masks are non-existent. Infections here are rising. These makeshift tents house nearly 1 million people who fled Russian and regime airstrikes. Fresh snow covers plastic tents this winter. The season brings fierce wind and rain, flooding their homes.
We have no bread, no food, nothing. No heater, no blankets, no oven for us to cook. We have nothing. Go look inside that tent over there. Everyone is sick.
หนูอยู่ที่ตลาดไทยค่ะ เป็นโรงงานค่ะ แต่ว่าเป็นโควิด -19 นี่เขาก็ให้พักงานแล้วก็ลดงานด้วยค่ะ ทำงาน2 วันหยุดวันนึงค่ะ หนูก็เต็มไม่พอค่ะ ทีนี้หนูก็มีลูกต้องส่งให้ลูกแล้วก็พ่อกับแม่ค่ะ ตอนนี้หนูอยู่ที่เก่าไม่ได้ค่ะ หนูก็ต้องหางานใหม่ค่ะ
มีผลกระทบเยอะเลยค่ะลูกค้าหายไปครึ่งรายได้หายไปครึ่งเลยก็น่าจะมีพวกขายของออนไลน์มากขึ้นนะตามลักษณะแล้วเนาะไม่งั้นต้องเข้าให้ถึงลูกค้าเลยอ่ะเข้าให้ถึงลูกค้าไม่ได้แย่
Di po di ako nakakaranas ng gutom. Ngayon po nararanasan ko na. Kapag wala ka pong pagkain, di ka ka pa nakakakain, tatamarin ka kumilos, kumbaga lumpapay ka na lang, parang nanginginig ka na lang sa gutom nung di ka na magsasalita. Siyempre po, parang nakakaya rin yun, yung nagpupulit ng gulay. Siyempre mas unahin mong makakain ka kaysa mayayaya ka pa.
Like her, more than 5 million Filipinos have gone hungry in one of the world's toughest and longest COVID-19 lockdowns.
Hindi kami natakot mamatay sa COVID. Takot kami na mamatay sa gutom.
Ay, Lut!
Nakakasana yung gutom sa toyo at saka kanin. Asin or ano man. Ayun, basta maano lang yung gutom. Iiyakan ka talaga kapag gutom. Alam mo, mga bata, minsan napapalo mo na lang kapag wala ka talaga, kaya pipilitin ka kung wala.
Baka iniisip ni mama na hindi niya kaya bigay lahat ng kung yung anong gusto namin ulam, anong gusto namin, ayun lang nabibigay niya kasi po lockdown. Pero kahit asin lang, okay lang sa amin, nakakakain kami.
Leia's mum received just $138 2 months after the lockdown began, the equivalent of 4 days' income for her. It was gone within a week.
Mapipilitan ako kailangan Hindi ko naman pabayaan.
The majority waited so long, and also the tranche they got was next to nothing. It was equivalent to about 9 pesos per person per day over the last 5 months. You can't do anything with that.
Measures like safe distancing and face masks are luxuries for slum dwellers.
Space is a luxury for the rich. So the poor, they live in small homes in crowded, congested communities. The poor really have it worse in the normal time. They also have it worse, I think, in times of crisis right now.
When a crisis like this hits an unequal society like the Philippines, it's like amplifying the inequality and the social divide. So it would be very difficult for them to recover economically from this crisis.